Inherited diseases, also known as genetic diseases or hereditary diseases, are conditions caused by abnormalities in an individual's DNA. These abnormalities can range from a single gene mutation to a major chromosomal anomaly. They are passed down from parents to their children through their genes. Here's a list of common inherited diseases, categorized by the type of genetic inheritance or the system they primarily affect. 1. Single gene disorders, Mendelian disorders. These are caused by mutations in a single gene. Autosomal dominant, only one copy of the altered gene is needed to cause the disorder. Huntington's disease, neurodegenerative disorder affecting muscle coordination and cognitive decline. Marfan syndrome, affects connective tissue, leading to problems in the heart, blood vessels, bones, joints, and eyes. Polycystic kidney disease, PKD, causes cysts to grow in the kidneys, leading to kidney failure. Neurofibromatosis type 1, NF1, causes tumors to grow on nerves throughout the body. Achondroplasia, a form of short-limb dwarfism. Autosomal recessive, 2 copies of the altered gene, one from each parent, are needed for the disorder to manifest. Carriers, individuals with one altered gene, usually don't show symptoms. Cystic fibrosis, CF, affects mucus and sweat glands, primarily impacting the lungs and digestive system. Sickle cell anemia, affects red blood cells, causing them to become crescent-shaped, leading to anemia, pain crises, and organ damage. Thalassemia, a group of blood disorders characterized by abnormal hemoglobin production, leading to anemia. Common in the Philippines. Tay-Sachs disease, neurodegenerative disorder, leading to progressive destruction of nerve cells in the brain and spinal cord. Phenylketonuria, PKU, metabolic disorder where the body can't process phenylalanine, an amino acid. Spinal muscular atrophy, SMA, genetic disease that affects the nerve cells that control voluntary muscles. Albinism, a group of genetic disorders characterized by a lack of pigment in the skin, hair, and eyes. X-linked dominant, caused by mutations on the X chromosome, and one altered copy is sufficient. If a male has it, all his daughters will inherit it. Fragile X syndrome, the most common inherited cause of intellectual disability. Rett syndrome, neurodevelopmental disorder primarily affecting girls. X-linked recessive caused by mutations on the X chromosome. Males are more frequently affected because they have only one X chromosome. Females can be carriers. Hemophilia, blood clotting disorder. Duchenne muscular dystrophy, DMD, progressive muscle weakness and wasting. Red-green color blindness, most common type of color blindness. 2. Chromosomal disorders. Result from abnormalities in the number or structure of chromosomes. Down syndrome, trisomy 21, an extra copy of chromosome 21, leading to intellectual disability and characteristic physical features. Turner syndrome, occurs in females when one of the X chromosomes is missing or partially missing. Klinefelter syndrome, occurs in males who have an extra X chromosome, XXY. Patau syndrome, trisomy 13, an extra copy of chromosome 13, causing severe intellectual disability and physical abnormalities. Edwards syndrome, trisomy 18, an extra copy of chromosome 18, causing severe intellectual disability and birth defects. 3. Multifactorial, complex, disorders, caused by a combination of genetic predispositions and environmental factors. While genes play a role, the inheritance pattern is not as straightforward as single gene disorders. Heart disease. Many types of heart disease have a genetic component, especially early onset forms. Diabetes, type 1 and type 2, both types have genetic influences. Asthma, a chronic respiratory condition with a genetic predisposition. Cancer, many types, while not purely inherited, specific genes, for example, BRCA1/BRCA2 for breast/ovarian cancer, can significantly increase risk. Alzheimer's disease, specific genes, for example, AP, can increase the risk of late-onset Alzheimer's. Obesity, genetic factors can influence metabolism and appetite. Autoimmune diseases, for example, rheumatoid arthritis, lupus, multiple sclerosis, often have a genetic component. Birth defects, for example, cleft lip and palate, spina bifida, can have multifactorial causes. 4. Mitochondrial inheritance. Mitochondrial DNA, MSNA, is inherited exclusively from the mother. Leber's hereditary optic neuropathy, LHON, causes vision loss, primarily in young men. Mitochondrial encephalomyopathy, lactic acidosis, and stroke-like episodes, MELAS, syndrome, affects multiple body systems, especially the brain and muscles. It's important to note that the presence of an inherited disease in a family doesn't always mean that every family member will develop it, especially for multifactorial conditions or in cases of recessive inheritance where individuals might be carriers. Genetic counseling can help families understand the risks and options. Have you ever wondered how diseases can run in families? It's intriguing, right? Today, we'll explore inherited diseases and why they matter. Inherited diseases are health conditions passed from parents to children. They involve gene mutations that can affect various bodily functions. Understanding these diseases helps us grasp our family health history. First, let's look at autosomal dominant disorders. These need just one mutated gene to manifest. Examples include Huntington's disease and Marfan syndrome. Now, consider autosomal recessive disorders. These require two mutated genes to show symptoms. Cystic fibrosis and sickle cell disease fall under this category. Next up, are X-linked disorders. These mainly affect men. An example is hemophilia. Women can be carriers but often don't show symptoms. Mitochondrial disorders are another type. These arise from mutations in mitochondrial DNA and affect energy production. Understanding these categories helps identify which diseases may be relevant to your family. Knowing your family's health history can guide necessary lifestyle choices and medical tests. For instance, if a family member has cystic fibrosis, it may prompt genetic testing. This can help forecast risks for future children. To sum up, understanding inherited diseases aids in recognizing potential health issues. Family health history is a crucial tool. It helps us take informed steps for our well-being. If you found this information helpful, consider discussing your family health history with a doctor. Empower yourself with knowledge to make better health decisions.